Good morning, everybody. We had a record 133,000 tests to 8 p.m. yesterday, which is a great result. We encourage people to keep coming forward to get tested to make sure we're scooping up all the cases that are out there in the community. There were 283 cases of community transmission, with at least 64 of them infectious for that time in the community. Horribly, we had one death overnight, a woman in her 90s who was in palliative care. She was unvaccinated, but our deepest heartfelt condolences to her loved ones. All deaths are horrible during this time, and again, we extend our deepest sympathy to her loved ones at this difficult time. The epicentre of the virus in New South Wales and Sydney still remains the Canterbury-Bankstown local government area. We are seeing some stabilisation in other local government areas, but that local government area is proving to demonstrate the virus is still circulating, and we also ask people in those adjoining local, or suburbs I should say, in those adjoining suburbs to the Canterbury-Bankstown local government area to especially be on high alert. That remains the greatest challenge for us, and it's where the compliance, the police are focusing their efforts as well to make sure people are doing the right thing. So we please ask everybody in that local government area to be especially careful, not to leave home unless you absolutely have to. And of course, we're asking people not to go into those areas unless it's absolutely essential. You should not be going anywhere near those local government areas if you live outside those communities. Please know that is proving to be an ongoing threat. Unfortunately, somebody from Newcastle went to Tamworth, and there's a number of exposure sites in Tamworth. There aren't any cases there yet, but we do know the person went from Newcastle to Tamworth and visited a number of locations. So as a precaution, the health experts have recommended that we lock down Tamworth for 1 week, starting from 5 o'clock today. I understand there's already been discussions with community leaders and people on the ground in that area. So there aren't any cases yet, but there have been a number of confirmed exposure sites because somebody left Newcastle and went to Tamworth who was infected at the time. There's also a call out for everybody in and around the Byron community to come forward and get tested. So the Northern Rivers community is on high alert at this stage. There won't be any further action taken, but I understand, and Dr. Chant will elaborate, that there is a case there, someone who's been mobile, and of course health are still determining the extent of that mobility and where they went. So we are calling out everybody in Byron in the Northern Rivers community has any symptoms to come forward and get tested, and the health experts are watching that community very closely. Today is a positive day for HSC students in those local government areas of concern. We're looking forward to welcoming them all to Kudos Bank Arena today and having them vaccinated. We know how key the vaccination is, not just to obviously preventing people from going into hospital, but from reducing the spread. And we're especially pleased that we're giving HSC students the opportunity to safely sit their exams to make sure they're vaccinated by the time their exams roll round. And I want to thank all those students who've already registered, those that are turning up, and we hope to see thousands vaccinated during the course of this week. And of course, from next week, Kudos Bank Arena will open up into a broader mass vaccination hub, joining the number of mass vaccination hubs throughout Greater Sydney and New South Wales. Can I also welcome today in particular Dr. Richard Totaro, who is the manager of the ICU unit at RPA. He deals with COVID patients on a daily basis, and we thought it opportune for him to discuss what he sees and what he's recommending to the great citizens of our state in relation to dealing with COVID. So a big welcome to Dr. Richard, and what we'll do is, obviously after Dr. Richard speaks, we'll ask the media to provide him with any questions so that he can leave and get back to his important work, with all due respect to everybody here. So I'll now get Dr. Chant to provide her update, and then we'll ask Dr. Richard Totaro to say a few words.
Thank you very much, Premier. So there are 283 locally acquired cases of COVID and a record number of tests, 133,840. In terms of there are currently 349 COVID cases admitted to hospital, with 67 in intensive care and 27 of whom require ventilation. In terms of the areas we are most concerned about, we're most concerned about the Canterbury-Bankstown area, and also we're seeing stabilisation in Fairfield, but still reasonably high case levels in Fairfield, Liverpool, Blacktown and Penrith. Particularly that eastern area where we took that action yesterday to introduce further restrictions. In terms of the Tamworth lockdown provisions, I'll just disclose that a young lady was exposed to COVID in Newcastle. She then travelled to Tamworth on the evening of the 4th, arriving in Tamworth on the 5th. She attended a number of venues, and I'll read those out, and anyone who's been at these venues is considered a close contact and must get tested and isolate for 14 days. And we've also got a number of casual contact venues. So in terms of the venues where we're requiring people to immediately isolate and get tested, and you're going to have to stay in that isolation for 14 days, it's the Inland Cafe Tamworth on Thursday the 5th of August from 9:15 to 10 a.m. The Tudor Hotel Tamworth on Thursday the 5th of August from 11 a.m. to 11:40 a.m. And the Habesha Ethiopian Restaurant, The Junction, at any time on Friday the 31st of July to Thursday the 5th of August. And the Mr Rice Takeaway, Cooks Hill, on Wednesday the 4th of August from 3 p.m. to 3:20 p.m. And anyone who attended the following venues on the specified dates and times are casual contacts and must get tested and isolate until a negative test result is received. And that is the Gloria Jean's Tamworth on Thursday the 5th of August 9:15 to 9:20 a.m. The Super Vape Stall in Tamworth on Thursday the 5th of August from 10:55 to 11:05, and the Ampol Roadhouse on Thursday the 5th of August from 12:25 to 12:30. She then returned to Newcastle on the 5th of August, and hence why there are no additional exposure venues from that time. The Premier mentioned that we have been alerted overnight to a gentleman in his 50s who is staying in the Byron area. Investigations are underway to determine his source of infection. We understand he did travel from Sydney earlier in towards the end of July. He is currently being re-interviewed, and we are also arranging urgent testing of his 2 household contacts. And once we have more information, we'll be alerting to the community in terms of any venues that he's checked into. At the moment, we don't have any venues that he's checked in using his QR codes at this time. Thank you.
Oh, yes. Hello. There's a lot of focus about cases and total case numbers in the state. The thing about the case numbers is that eventually those cases funnel into the ICU. ICUs across the state are a relatively limited resource. They're usually quite full. And the ICUs are really the centre of hospitals. It allows us to do things like heart surgery, complex obstetrics. It allows us to look after patients who've had multiple trauma. It allows us to do leukemia treatments. A whole variety of things need access to the intensive care unit. This disease is a disease where a small number of people who get sick end up in the intensive care unit, and they stay in the ICU quite a long time. Normally, patients in the ICU are there for 3-4 days on average. Patients who have COVID, who end up on ventilators, on the breathing machine, on life support, stay in ICU from the UK data something like 3 weeks. If you're in the ICU and you're on life support and you're on dialysis, you stay in the ICU somewhere around 5 weeks. So you can see how a unit which is designed to have patients coming through at high numbers, lots of throughput, all of a sudden these patients come in, they slow the flow down, they slow everything down. It makes the unit slowly fill up. We've got access to ICUs at the moment in Sydney, lots of room. ICUs are a combination of a very complicated bed, lots of infrastructure, machines, but much more importantly than that is ICUs are built around intensive care, and the intensive carers in our ICUs are the nurses. Our nurses are absolutely vital to providing the technical skills of looking after the machines, are vital to looking after the patients and recognising when they're getting sick, when they're getting better. and also to providing compassionate care to the patients when they're having, the worst time of their lives, and the patients' families. COVID has really changed how we have to deal with families. We can't do face-to-face meetings. We have to do this digitally, and it really adds an extra layer of complexity. Looking after COVID patients is very hard work. It's really demanding. You're in layers of PPE, which is hot. Particularly for the nurses, it's difficult work. It's physical work. For the medical staff, if you're doing procedures, if you're doing operations on these patients, you've got the PPE and then sterile equipment over the top of that. It can be very difficult work. And these are really sick patients. So what we want to do is take these patients who are really sick and stop having them. We want to stop people getting sick and ending up in ICU. And there's really good evidence from all over the world that the vaccinations that we have available to us stop people, once they're vaccinated, stop people needing to come into hospital. Almost all the hospitalisation goes away. Almost all the need for ICU goes away. And almost all the death goes away once people have been vaccinated properly. And that's what we want to see. You take this disease, which in older people, 10-20% of people end up in ICU, and you make it a much more mild disease. A disease that can be managed as outpatients, it can be managed with telehealth and so on, rather than burdening the hospitals, overrunning hospitals. And we know from having looked around the world that when hospitals are overburdened, when they're running at overcapacity, more people die than would have otherwise.
Doctor, do you hear from patients who have ended up in the ICU, like we've seen in other parts of the world, that they regret not getting vaccinated?
Unfortunately, once patients come to my ICU, most of them are too sick to be talking to us. They're on ventilators, they're feeling really sick, and I personally haven't heard that. I'm aware of other people around who've been told that, yes.
Doctor, are you worried about the capacity of our current hospital system and the ICU system more broadly? Are you worried about that coping with the spread of this outbreak?
At the moment, the hospital system is responding really well. Everyone is pulling together. There are reconfigurations and a whole pile of stuff being done to help us cope. So at the moment, we're responding really well.
Doctor, how many ICU beds does a regional hospital typically have? How many sick COVID patients can they handle before they need to start transferring to a city hospital, patients away from their families and that sort of thing?
Most regional ICUs are smaller than big hospital ICUs, but it's not so much the number of beds, it's the amount of staff. And at the moment, the regional hospitals are well staffed, they're running okay.
Dr. Totaro, how many cases a day could New South Wales withstand at the moment before the ICU is under significant stress and we see more lives lost than should be?
I actually don't know the answer to that. I'd have to turn to our public health experts to give me advice on that.
Do you think at 200 to 300 cases a day, what you're seeing at the moment, until November where there's 80% double dose, the ICU systems could manage, or are you concerned about keeping 200 to 300 cases a day until that period?
We've been running at about 200 to 300 cases a day for a little while, and the ICUs are managing well. Yeah.
Doctor, this might be a question more suited to Dr. Cha, but perhaps you know the answer. You mentioned reconfigurations to make sure that the hospital system is on top of things. Are COVID positive patients in hospital being transferred from Sydney hospitals like yours to other hospitals, potentially Wollongong?
Not that I'm aware of. No.
Dr. Cha, maybe not. Sorry.
Hi. There'll be clinical decisions about patients moving wherever is clinically appropriate to do based on ICU availability. Clearly, a large number of the southwestern Sydney communities live very close to Wollongong, so whilst it sounds distant, there is actually quite connectivity. So I wouldn't rule out anything. What we're more committed to is making sure that people have access to the best care. And can I just also acknowledge that the intensive care that is provided in the Australian context is one of the best in the world. But I think that you would actually say the key message is get vaccinated. We do not want to see anyone in ICU, and we have the tools to prevent you go into ICU, and that's getting vaccinated. And I don't think we've seen anyone who's had the 2 doses of vaccine in ICU, and I think it's really critical for people to go out and get vaccinated. Can I also just go back to my call out about Byron? I should have also mentioned that we do need to get testing numbers in that Byron community up, so anyone with signs and symptoms. Unfortunately, this gentleman was infectious in the community for a while. He had symptoms for several days, so we are quite concerned, and we do want to see those testing numbers increase in that area, and we'll be monitoring that closely.
Sorry, before I hand back to Dr. Totaro, can I also make this point, that it's not so much when it comes to intensive care units and the number of patients in there, it's not so much the number of cases we have, it's the number of cases we have that aren't vaccinated. Because vaccination is keeping people out of ICU, it's keeping people out of hospital. So it's not the total number of cases you need to look at to predict what's going to happen in intensive care. It's the total number of cases that aren't vaccinated which will give you an indication of what's in the ICU. And as Dr. Totaro will stress, it's a relief to us that both vaccines are holding up really well. Both vaccines are demonstrating keeping people out of hospital, keeping people out of harm's way, and also reducing the spread. And that's why to our outstanding health teams across the hospital network who are dealing with COVID patients every day, who see the pain and suffering that we don't see, their families do, and the staff do, what we can do to support them is to make sure we get vaccinated.
Would you agree though, Premier, 50%?
For Dr. Totaro first.
Come on, mate.
Dr. Totaro first. Yeah. Then he can go to work.
Thank you.
Other jurisdictions you're looking at overseas, is there anything comparable? Like Quebec was mentioned yesterday as something that's comparable in New South Wales. Are there other jurisdictions you look at overseas where you're modelling how your hospitals can cope and how your ICU wards can cope?
New South Wales is pretty lucky. We've got controlled numbers at the moment and very different to what we've seen in the US, the UK, through Europe. So we can look at their numbers for how many people need to be in ICU and how many people need, how long they're going to be with us. Yeah. But, you know, for us, the really striking thing is that we haven't seen anyone who's had 2 vaccines, both their vaccines, come to the ICU and need to be with us. Nobody on ventilators with 2 vaccines, nobody on ECMO, nobody in the ICU needing after having had 2 vaccines. And if people get themselves vaccinated, they're helping themselves because you'll stop yourself getting sick. You're going to stop the people around you, your family, your loved ones, the people that you live with and work with from getting sick because they won't get it from you because you're not going to get it. And you're going to help the whole community because, one, the higher the vaccination rates we have, the less people there are getting sick. And 2, then we can go back to having the sort of, you know, back to our lives that we had before. So getting everybody vaccinated, older people, young people, absolutely have to go out and get vaccinated. That's a really important thing from us.
Can you talk to me on a personal level about the fact that there would obviously be a lot more young people now in these ICUs, and aside from car crashes, you wouldn't often see young people in those ICUs. Can you talk to us about, on a personal level, how different it has been, how shocking it has been for you, and obviously they deteriorate quite fast sometimes?
So ICUs look after people of all ages, and having young people in the ICU is not uncommon. So we're used to looking after a broad range of ages in the adult ICUs. The remarkable thing about this disease is in people who aren't vaccinated, just how progressive and relentless the deterioration can be, and how progressive and incredibly sick patients can become. So it's a really difficult, really complex disease that we're looking after.
On that young people question, would you say that people that are under 30 have underlying health conditions, or are they physically fit and well adults, in your opinion?
We've had people who are physically fit and well and who don't have underlying conditions.
Is it heartbreaking for you to see people in ICU knowing now that we do have two perfectly good vaccines that could prevent this level of illness? It must be so hard.
Yeah, knowing that there is access to vaccination in the community, knowing that it's available to all age groups above 18 now, it's really difficult seeing people in the ICU getting so sick and suffering what will be quite long-term consequences. The ones who are really sick, we know, have both long COVID, you know, the symptoms that you hear about, also the complications of just having been critically ill that can stretch out for weeks and months after their recovery from critical illness. Things like muscle wasting and fatigue, things like depression and sleep problems. You know, you can't imagine anything more traumatic than being in an ICU and being critically ill. So post-traumatic stress disorder, all things that we know happen to people who have been critically ill, and definitely things that happen to people with COVID.
Doctor, if they've been in ICU, you mentioned 3 weeks, that period of 3 weeks, does that mean they're then transferred to a general ward and then use up a general ward bed for even longer?
Two things can happen. One is they still need, once they clear the virus and they're not infectious anymore, they move out of the COVID ICUs, and if they still need ICU, they go to the general areas of the ICU and continue to get general ICU, but without needing all the extra layers of protection that we give to the COVID patients. Once they're ready to leave the ICU, they can either go, if they're still infectious, they'll go to the COVID wards, or if they're not, they'll go to the general wards. And often we'll have long lengths of stay in the wards as well. So it slows down the general hospital too.
How is it for staff? I hear it's like running a marathon in there.
It is. It's tough, hard work. The nurses in particular, who are at the bedside for hours at a time, doing, you know, all the important hygiene and physical stuff that they have to do. It's very tough, very hard work, and constant vigilance around themselves and around their others, making sure that there's no breaches in their PPE, making sure that they're keeping themselves safe and protected.
Thanks, Dr.
Thank you. Dr. Charles, the woman who travelled from Newcastle to Tamworth, no, she was infectious.
No, the person who travelled to Tamworth at the time did not know she was infectious. It was subsequent to that she became aware, and she's now back in Newcastle and is isolating. Obviously, we're concerned about those exposure venues, so we need those high testing rates, and obviously the action is being put in place from 5 p.m. today. But I would urge everyone to reconsider their movements today. We do want to make sure we've reached everyone that are in those venues, and so please limit your movements even ahead of the orders coming in to take effect.
Why was the man from Sydney in Byron Bay?
That's still the subject of investigations. Yes, I can just say that matter is under investigation.
He hasn't been punished, he hasn't been received any punishment?
Sorry. Can I just say the gentleman himself is actually admitted to hospital at the moment. So obviously the family and next of kin are being interviewed to ascertain the information. Obviously, if there are any breaches or any issues, we work closely with the police, and can I just say I thank the police for their operational support.
Had he moved between two places of residence, two houses that he owns, because that would have been illegal under the LPS?
No, my understanding is that there are other aspects here. I really can't speculate. Literally, the gentleman is in hospital, and we are interviewing those around him to find out the details.
Can you tell us what the reproductive rate is at the moment? And given where it is, do you think at the end of August we can only lift a few restrictions, minimal restrictions? And when Paul Kelly has said to you, he spoke to you about a circuit breaker, what was that circuit breaker as you understand it?
So in terms of where we are going, I think the numbers speak for themselves. We're still seeing quite a number of people infectious in the community. We need to all play our part in decreasing our mobility and stay the course. As you've heard from the ICU director at RPA, the consequences of people's actions and failure to follow the public health advice can lead to your loved ones being impacted, and your loved ones could end up in ICU and could tragically die. So I just can't stress it enough that this is not a time for complacency. We are at a key, we are working very hard to maintain this and to continue to look at opportunities for driving down the case numbers.
Does that include restrictions?
in terms, we have continually reviewing the restriction levels, and clearly you noted yesterday we had added Penrith as an area of concern given the case numbers there.
So what says circuit breaker? Sorry, just
so in terms of Dr. Kelly's circuit breaker, look, I think it's difficult to speculate. I suspect that he wants to see good compliance activity, and we've put that certainly we've stepped up the compliance activity. Vaccination forms part of that, and also this intensive lockdown that we have in Sydney. But we have a way out with vaccination, and I can't echo Dr. Richard's comments again. I urge everyone to go and get vaccinated. That is the one thing that we can do, as well as follow the public health advice.
Dr. Totaro, the local health district has confirmed that a number of people have been transferred to Wollongong Hospital. How long has that been earmarked for, and has that played any role in Wollongong and Shellharbour's continuation of lockdown?
No, the reasons for the continuation of the lockdown for Wollongong and Shellharbour is I've been standing up here many times and indicating that there are people that have become positive in that area, and that's because it is a very connected area. When you look at the areas in southwestern Sydney that are the epicentre, a number of those communities are connected to Wollongong and that vicinity. So the issue is that we are using our full ICU network, and New South Wales Health is a great system where we deploy those resources in a networked way.
They're coming from Liverpool, so you're saying that it's not a sign that there's too much pressure or there's too much stress on the system in Sydney that patients have had to be transferred to Wollongong?
It's appropriate. I mean, we see Wollongong as part of Sydney. It's part of the Sydney network. It has a strong intensive care unit. And you can imagine that for many people that live in Liverpool or Campbelltown, Wollongong is actually closer than the city. So we use all our assets, and that includes Wollongong.
Premier, you requested a reassessment of a $5.5 million grant that Darryl Maguire stood to gain a political benefit from.
Can you please stand back a bit? Thank you.
Why did you do that? And isn't that a serious conflict of interest given you were in a secret relationship with him at the time?
Firstly, the proposition you're putting is absolutely ridiculous, and second, all proper processes were followed, and that's all I say on the matter.
Well,
Thank you.
We've seen the letters that you exchanged letters with Darryl Maguire about this project. You wrote to him, you thanked him for bringing it to the government's attention. Wasn't it a serious conflict of interest getting involved in any way in that grant process, given you were in a relationship at the time?
I refer you to my previous answer, and please respect this press conference. Any other questions?
In terms of Tanya Davies, one of your backbenchers, has released a statement. She's concerned about construction. Some other MPs too. Are you facing a bit of a revolt from some of your MPs just about the decisions that your crisis cabinet's making?
Look, this is a difficult time for everybody, but when you are in a lockdown and when you know there are a high number of cases circulating in particular communities, you need to make decisions for the greater good. And can I firstly thank industry for really stepping up? The stakeholders in business who've spoken to government about how we can get workers back to work, especially from those areas of high concern at the moment, has been very positive and constructive. And can I please thank all of business leaders, community leaders who've supported us in our efforts. As you can appreciate, so many people from those 8, now some 9 local government areas of concern aren't allowed to leave their homes. And the fact that some people are being offered that opportunity is a positive. And obviously the New South Wales government respects people's views on these matters, but we also appreciate that during a very difficult time you need to think about the greater good and not continue the spread of the virus, but the opposite. So we're just saying to people in those local government areas, if you work in that particular industry, there are really good COVID safety plans in place. And please, if you want to work now, when many colleagues in different industries can't, if you want the chance to do that, just follow the COVID safety plan. And as we know...
50% vaccination rate, sorry, but obviously that's first dose. Doesn't that mean...
No, I haven't said first dose.
Well, you mean by the end of August?
I said 6 million jabs, yeah.
The end of August, that's 50% first dose, right? Does that mean it can only be minimal restrictions if it's still 200, 300 cases a day, like hairdressers, like a couple of industries, as opposed to a more widespread thing? And secondly, when could kids potentially go back 1 day a week to school, for example?
Can I just make clear that the target I've set for New South Wales is 6 million jabs. So it could very well be that we have maybe 60% of first doses and 40-something% of second doses. So we've set the target of 6 million jabs by the end of August, by which time the health experts will have more confidence to put to us some things that can be eased. Now, it will also depend on what the case numbers are looking at like in 3 weeks' time. And I hope they're lower than what they are today, but we don't know. Heaven forbid they could be higher. And that's really up to us. It's up to us to make sure we continue to do the right thing. So the 6 million jabs gives us opportunities to consider what restrictions we can ease. It gives us opportunities to think about what life in September looks like. And can I please urge everybody, if you're able to get a jab, go get a jab. I can't stress that enough. I'm really pleased that HSC students today will be offered that opportunity for the first time with the Pfizer dose, but I really, really hope that everybody is considering the vaccination options. And again, you don't need to listen to me, but listen to Dr. Totaro, who runs the ICU units in RPA.
Is it quite minimal if we get to that level, or are you thinking about bigger step-out things like one day a week at school?
Can I say that health and safety of our population is always our first and foremost priority, but so is mental health, and so is making sure that we transition as we move through the higher vaccination rate. So the government is considering our options. We want to make sure every step we take is a safe one, but that will be dependent on two things. Firstly, the number of jabs we get into arms between now and then. I think as of today, we have 4.5 million jabs, which is a good result. I'm hoping we get to 5 million jabs sometime next week. And then we have the home run to 6 million jabs by the end of August. As all the leading health experts say, I don't think I've heard a health expert anywhere in the world not say this. You don't have to believe elected people like me. Believe what the health experts say. The health experts say vaccination stops you going to hospital. It stops you spreading it to your loved ones. You can still spread it, but not at the rate which we're seeing now. And it also makes sure that we have a chance to get those case numbers down.
The vaccination hub opened up today.
I'm sorry to hear the first
Wollongong's vaccination hub opened up officially today, a week early. But people from Shellharbour and further south are now having to travel to Wollongong to get their vaccination. Is it concerning to make these people move across LGAs where previously they could have got it in Shellharbour?
Oh, look, please know that in addition to the New South Wales government or health-run mass vaccination hubs, we have GPs, we have pharmacists, we have a number of points of access. So if you don't live near if you're in rural and regional communities, we have over 100 sites at the moment that are run through New South Wales Health. But if you have concerns about where you can access the vaccine and you live in a regional community, first and foremost contact your GP and they may be able to offer you a vaccine. So please know we're increasing the points of access as much as we can. And can I in particular thank the Pharmacy Guild of Australia. The presence they have in New South Wales and the way they've been able to scale up is outstanding. They also, I understand this morning, have new website facilities to allow you to go to your closest pharmacist that's offering the jab. So please know that no matter where you live, whether it's in Greater Sydney or in our regions, you have access to New South Wales health-run sites, access to the GP network, access to pharmacists, and in some parts of those 8 local government areas, we're also going out to community places of worship, community halls where people feel comfortable. So there's a number of ways people can access the vaccine. I'd love to have it at the corner of every street, but that's not possible. So please know that anyone who needs or wants to get the vaccine in New South Wales should do so.
Incentives in opening up.
I'm sorry, I didn't get the
You foreshadowed incentives in opening up for areas and postcodes that have 0 cases. Should you consider doing the same thing for areas with greater vaccination uptake?
Oh, well, look, obviously what we're keen to see is vaccination rates go up across the state, but in particular, we will have greater confidence in opening up things if the vaccination rate in those areas of concern increases, because we know that if we get the vaccination rate up in those areas of concern, it reduces the likelihood of having the spread continue the way it is. At the moment, we're seeing if you're not vaccinated and you have a large family, you're likely to go home and give it to every single member of your family. But if you do have the vaccine, chances are you won't give it to every single person in your family, and then each family member might leave the house for a purpose, and then that obviously continues the spread. So it's important for us to get those jabs up, but also in particular, this has been the experience overseas in provinces throughout Canada, that a targeted vaccination program in those areas of concern has strong evidence of reducing the spread and allowing communities to live more freely, and that's why we're really appealing to people to consider their options. I was so pleased yesterday to see so many people come forward who work in supermarkets and front-end food retail in particular to come and get the jab. That means there's a couple of thousand people walking around today who will be in 3 weeks' time much more protected than they were. There'll be people who work in our supermarkets, authorised workers from those local government areas in particular, who will then reduce the chances of getting the virus or spreading it to others, and that's a positive. And we'll be having similar days for different industry groups on Sundays moving forward. We really want to encourage workers to get that vaccination, but also please think about the future. If you work in an industry where you'd like to go back to serving customers or go back to having one-on-one service to people, or you work in a workplace which is currently not open, please consider getting vaccinated, because the higher the rates of vaccination, especially through workers, the more confidence we'll have to ease restrictions and open things up. Who hasn't asked the question? Yeah.
In Victoria, they introduced a $450 payment so people stayed home while they waited for test results. Why haven't we done that, given we have this terrible problem of people being out in the community?
Well, as you know, we have $750 a week disaster payments. We've also managed to make sure we have payments for people who might be already on an existing welfare payment to provide to close that gap. We also have direct support for people living in particular in those 8 local government areas. And I want to thank the non-government organisations and the community leaders and multicultural organisations who are working with government to provide direct assistance to households, which we're already doing. So please know that is work that is happening now. It's tied in with the fact that obviously we don't want people to leave home, so we're making sure they have every support they need. People are getting what they need over and above those payments that are offered. We're always looking at opportunities to do more, but please rest assured we've thought and worked very hard to make sure people in those communities get every support they need so that people don't feel they've got to break the rules. And can I also thank the New South Wales Police Force working hand in hand with the ADF, non-government organisations on the ground, as well as New South Wales government agencies to provide that support to communities in those affected areas.
Weeks ago, the New South Wales government was asked to set up a walk-in vaccination hub in Mount Druitt around those vulnerable areas. Why are there no moves afoot yet to actually get that done?
Oh, look, please know we're looking to open up as many vaccination hubs as we can. What we desperately need also is doses and people coming forward to get the jab. So please know.
Is there a move afoot to get a vaccination walk-up hub in Mount Druitt?
Well, we're making sure, obviously, I'll speak to our health experts, our operations people in health, but please know that we are making sure that in those 8 local government areas of concern in particular, that people do have access to a jab, whether it's through Homebush or through Kudos Bank Arena from next week, through various vaccination hubs and multiple pop-up sites. We're making sure people have access to that, as well as an increasing pharmacy network, increasing GP network. This is all critical in making sure that people do feel they have access. And please know that many people who are authorised workers are leaving those areas to go work, and there are lots of vaccination opportunities throughout Greater Sydney. Please know that is not what's stopping people getting the jab. What is stopping people getting the jab is just the fact that people think they're not going to get sick, that somehow they're immune from it, but they're not.
If you've got a Pfizer appointment,
please ask people to come forward and get vaccinated.
Who
hasn't asked a question at the back? Yeah.
So why is the government pouring about $10 million into this fund when government debts and deficits are rising? And were you aware of this strategy by the Treasurer? Do you support it?
Oh, look, I ask you to ask the Treasurer for that. He's the best Treasurer in Australia, and I support what he's doing. And I'll go to Clinton, yep.
Just on the what people might be able to get, obviously we understand the caveat, we've got to hit 6 million, but, you know, would hairdressers be allowed back? Are other small businesses under consideration, that construction within the 8 LGAs? Could you give people at home?
Yes, certainly. Well, in relation to construction within the 8 LGAs, that can recommence if there's obviously sufficient vaccination rates. So we're already having a pathway for some industries. As to what will occur in September will very much depend on what happens in August. And it will depend on 2 things: how much we can reduce the case numbers, and I hope to goodness they're not going to go up, but they might. But the issue is, if we get enough people vaccinated, if we have enough people who are prevented from getting hospitalised, and that is the key issue for us. Once you hit 70% of vaccinations, we will be changing the way we think about the virus. We'll be talking about hospitalisation rather than cases, and we have to start thinking about that now, because as we've seen, touch wood, there isn't a single person, no matter whether they had comorbidities, no matter their age, no matter if they had other illnesses, there isn't a single person that's ended up in ICU in intensive care with 2 jabs of the virus. We know it works, so we will have confidence once we get the jabs up. If the health experts say it's okay, we will have confidence to open up, depending on the vaccination rate, depending on what case numbers are doing, and also depending on the geography of those cases, because we're desperately trying to reduce the caseload in those concentrated local government areas, because that is where the virus is concentrated, that is where it's seeping out from, and mainly because authorised workers continue not to be vaccinated. And that's why we're urging all authorised workers in particular, if you're on the list of workers that are allowed to leave the area, please go get the jab, not just for yourself or your family and loved ones, but for the broader community, because that'll help us get out of this quicker. I promise Clinton next.
Further on Ursula's reference to hairdressers, given you've got the target of 6 million jabs by the end of the month, will you give some examples of changes to restrictions that may occur at the end of that if you reach that target, so people have got an incentive to go and do it?
Well, look, it could be a number of things. I mean, as I said, the 2 priorities for the government are to get face-to-face teaching back, face-to-face learning back, I should say, and also getting people back to work. And both of those things will have positive benefits. Families struggling to work at home or work from home, but also teach their kids at home. I can't imagine what that would be like. But obviously, when people are allowed to go back to work, that means the industry they work in is also providing services to customers. So there's opportunities for us to consider all of that, so long as we get the number of jabs we need. And of course, if we know that the percentage of the jab, if we know that half our population is fully vaccinated, that gives you a lot of confidence to be able to ease some restrictions. And so therefore we are encouraging everybody to come forward, especially if you are an authorised worker, if you're someone that has to work and leave your home coming from those areas where the virus is still rampant. Please go and get the jab, because that means all of us can look forward to having greater freedoms in September.
James. You've been talking about easing restrictions when we get to a certain number of vaccinations, even if case numbers continue to climb. You want to ease restrictions even if there's cases in the community, but other states are chasing COVID zero. 2 federal government ministers have come out this morning saying that they expect state borders to be closed to New South Wales for the rest of the year. What would you say to the millions of people who want to go and visit friends and family interstate who will not be able to do that because of what the other states and territory leaders are doing?
Oh, look, I can't control what other state premiers and chief ministers do, and they've demonstrated their propensity to close borders to us all throughout this pandemic. So the responsibility of the New South Wales government is to ensure the health and safety and well-being of our 8 million citizens. But please know the New South Wales government has also seen ourselves as part of our nation, as part of Australia. And to this day, we're welcoming home Australians coming back to New South Wales. We see our role, yes, as the largest state in the nation, but also as Australians. And when Dr. Chant and I a few Fridays ago said this was a national emergency, what was happening in Greater Sydney, we meant that. Because when the largest state has a threat the way it does, you cannot pretend it's not going to impact the nation. You can't pretend it's not going to impact what other states choose to do. You can't pretend it's going to not impact other states, no matter how hard you work. And the Delta strain is different. And again, please know that New South Wales did very well until this point, knocking on the head all the other strains of COVID. But Delta has proved to be lethal all over the world, and we can't pretend Australia is any different. We can't, as well as we've done, we can't pretend that we're not going to get through this unless we have high rates of vaccination, and that's what we've been saying from day one, that vaccination will help us.
Should be prepared to open their borders to us if we've still got cases in the community.
Oh, look, that's a matter for them. But can I stress?
Yeah. In this state that wants to go in a state.
Yeah. Can I stress? Yeah. Can I stress? At the moment, nobody from New South Wales is going anywhere. So what we want to see is an improvement of that situation. We want to see us resort back to safer living, to more freedoms. And I want New South Wales to be the first state in Australia that hits all those targets of vaccination. And
go to any states if we still have cases when the other states and territories will not open to us if we still have cases. So surely...
But I'm sure if you asked the majority of people in our state, would you look forward to more freedoms than what we have now, I think the answer would be yes. Well, it's for us. It's more freedom. But at the moment now, nobody from New South Wales can travel anywhere anyway. So isn't it better for our citizens, for our health and safety and our well-being, to fight for our citizens to have those freedoms? And I remember other states closing borders to us when we had very low numbers of cases that weren't even Delta. So I think it's pretty predictable what the other states will do. I don't know about you guys, but I don't think any state premier is going to change their position on that. But what I do want to say, which is respectful to the National Cabinet process, is the Doherty report is an outstanding piece of research. The New South Wales Government is committed to respecting the National Cabinet's wishes in relation to the Doherty report. We're not intending to overstep our mark beyond what that report allows all the states to do. That report obviously allows certain freedoms at 70% vaccination, at 80% vaccination. And I do want to say respectfully that we respect the national process. We know there's expectations on each state to meet their challenge, to meet the standards in that report. New South Wales will do that. But please know that once we hit 50 or 60, lockdown plus easing some restrictions is very different to what the Doherty report says must happen at 70%.
Do you not want to tighten restrictions?
Sorry, Liz.
There are some suburbs, for example, Cremorne, Artarmon and Mossman, that have 0 active cases and have double dose vaccine rates at around 27%. Are they going to be, are you looking at a situation where they might be able to have, say, meet a friend in the park for a picnic, or, are they going to be the ones that get eased restrictions when we get to the end of August, or are you looking at blanket?
I think what we have to accept that the biggest threat, as the health experts say to us, is what we call seeding or transferring the virus through workplaces. And there's thousands of people that come out of those local government areas of concern every day because they have to. And Dr. Chant was telling us today that we're concerned about disability workers in particular who might be unvaccinated and the challenges that's posing that we noticed in the last few days. So our point is that whilst you have authorised workers that have high rates of non-vaccination, that is a risk to all of us. So the way we move forward is bringing everybody together along with us. You can't have the segregation to the extent where you can't just look at rates of vaccination in one suburb and the number of cases in isolation, because we're all connected. I mean, we're all connected as a nation, let alone as a state, as a city, and we have to accept that. So as much as we think we can hive things off and want more freedoms, we have to encourage each other and support each other to get the vaccine, not just where we live, but across the city, across occupations, across professions. It's in all of our interests to increase the rates of vaccination, especially in those communities where the rates of vaccination can be higher, where people are working because they have to, because we rely on them. We rely on them to support our aged care homes, our disability homes. We rely on them to get food to supermarkets. Because there's a cohort of workers that are moving around Greater Sydney, that poses a risk to all of us, and that's why we need to make sure we support them, support the great work they're doing by supporting them in getting vaccinated, supporting their employers to get on board. And I do really want to thank industry for encouraging their employees to come forward and get vaccinated, and that will support us. You haven't asked a question, sorry.
Just on the Year 12 students starting their mass vaccination today, we're still hearing from some of them in the hotspot LGAs that they're experiencing glitches when they're trying to book in. Are you confident we'll be able to do all 24,000 students this week? And just secondly, do we have any more clarity about when Year 12s will be able to return to the classroom?
Yeah, firstly, can I please say to any students in Year 12 in those local government areas, don't worry, there is capacity for you to get vaccinated this week. If you're experiencing glitches, we also have that telephone hotline number we gave on Friday, which you can ring to make sure you get your booking. We're actually wanting more people to come forward. I know there are thousands that have already made their bookings, but we have around 20,000, and I don't think we've reached anywhere near capacity yet. So if you're experiencing any glitches or any difficulties, please contact the hotline, even contact someone you know in the school community. But we're really, really keen to have students come forward and get vaccinated. It will ensure that they can attend their exams without risk of hospitalisation and with a reduced risk of spreading the virus if they happen to have it.
There's a
national emergency.
That's our last question.
What about teachers? Is there a plan to? Obviously, we've seen construction workers prioritised, shop workers prioritised. What about getting teachers vaccinated as a priority?
I'm sorry, I didn't get the button.
Teachers vaccinated
right.
as a priority.
Well, obviously, we've already been asking teachers to come forward and get vaccinated for some time. The vaccine is available. We've asked teachers for some time to come forward and get vaccinated. The opportunity is there now, and we encourage them to do so. We thank them for their patience in having to teach from home. And in fact, I often think about teachers who have their own children to supervise whilst teaching other people's children from home, and I can imagine how challenging that would be. So I really want to thank teachers for that, but also encourage them. We did provide some opportunities some weeks back for teachers, especially in those local government areas, to come forward and get the vaccination, but we encourage teachers all over the state. We encourage anybody with any frontline contact with anybody else in any workforce to come forward and vaccinate it. And schools, as you would appreciate, are environments where you can ensure COVID-safe plans and restrictions. That supervision level is there. There are other workplaces which perhaps require more compliance and more supervision. But in any event, anyone who works on the front line in any occupation, anyone who is currently at home unable to work and wants to work, please come forward and get vaccinated. That will help us have options as we go into September. But most importantly, please follow the rules, don't break them, and come forward and get vaccinated. Thanks, everybody. Thank you.
Why won't you tighten restrictions, Premier? If it's a